I get this question a lot. Do you need to be awake for endoscopy and colonoscopy? The answer is no. Different sedation techniques that we use for these procedures. The most commonly used are Propofol sedation or something called Fentanyl Midazolam sedation. Propofol is a very fast acting agent. Within few seconds of you getting the medication, you're sleeping, and the recovery is very fast too. So within 30 to 40 minutes of the procedure, you're wide awake and you go home. Fentanyl Versed is the other combination that we use for sedation that tends to linger on a little bit longer, so people are a little bit more groggy after the procedure. And very rarely we use general anesthesia for these procedures in certain circumstances. Sometimes if the patients have a lot of comorbidities, or if we anticipate a lot of food or fluid inside the stomach where we want to protect the airways, or in patients with very extremely high BMI, sometimes we tend to use general anesthesia. Even more rarely we do these procedures without sedation. In my practice, I do it only if the patient specifically requests me to do no sedation, because some of the patients want to actually see the screen and see what's happening when we do the procedure. Obviously, there's a little bit of discomfort involved, especially when the scope passes the throat into the esophagus, or when we're doing the colonoscopy when there are tight turns. If I do without sedation during the colonoscopy, I tend to use a pediatric scope, even for adults. And I tend to use water to inflate the colon rather than air, which is much more comfortable. You as a patient get to decide what sedation you want for the procedure based on your comfort zone. Thank you so much for watching. Please subscribe.